Hello, and thanks for joining me today. We're going to talk about something that is so important for every dog owner to know about, especially if you have one of those big, deep-chested dogs. We're talking about GDV syndrome. So picture this for a second. Your dogs just finished their dinner, maybe had a big drink of water, and now they just can't seem to settle down. They're pacing around, maybe whining a bit. It's a pretty common thing to see, and, 9 times out of 10, it's nothing to worry about. But, and this is a big but, for some dogs, that restlessness is the very first warning sign of a true medical emergency. And knowing what you're looking for can literally be the difference between life and death. Okay, let's get right into it. So first up, what in the world is GDV? It's an acronym you might have heard thrown around at the vet's office, and it stands for a very specific and very serious two-part problem. So let's break it down. The G and D stand for gastric dilatation. That's the part we all commonly call bloat. It's when the stomach just fills up with gas, kind of like a balloon. But the V is for volvulus, and that's the part that turns this into a full-blown crisis. It means that gas-filled stomach has actually twisted on itself, sealing off the entrance and the exit. And it is absolutely critical to understand this difference. Simple bloat on its own is serious, don't get me wrong, but GDV is a catastrophe. Think about it like this: a balloon filling with air. That's bloat. Now imagine twisting the neck of that balloon shut. Nothing can get in, nothing can get out, and the pressure just builds and builds. That twist is the volvulus. It doesn't just trap gas, it cuts off all the blood supply to the stomach, and that's what quickly leads to shock and organ damage. Now, this is not something that affects all dogs equally. Not at all. There are certain breeds and types of dogs that are way more likely to have this happen, and you really need to know if your dog is in one of those high-risk groups. As you can see, this list is pretty much all large, deep-chested breeds. We're talking about dogs that are kind of taller than they are wide, A Great Dane, for instance, has a huge risk. Some studies say as high as a 1 in 5 chance of developing bloat in their lifetime. It's their anatomy. It just gives the stomach more room to swing around and, get into trouble. But hey, it's not just about the breed. Genetics are a huge piece of the puzzle. If a dog's mom, dad, or sibling has had GDV, their risk goes way up. And then there's lifestyle. Dogs that wolf down one giant meal a day, or dogs that are just naturally very anxious or fearful, they're at a higher risk too. It's really a perfect storm of anatomy, genetics, and behavior. Okay, let's get to what is, without a doubt, the most important part of this whole discussion. What you as an owner need to be watching for. These are the red flags that mean stop everything and get to an emergency vet. I cannot stress this enough. Time is everything. Let's really look at these 4 signs. The absolute classic sign is the retching, but with nothing coming up. Your dog looks like they're trying to vomit, they're heaving, but nothing. Maybe just a little bit of white foam or saliva. If you see that, combined with a belly that looks swollen and feels hard, almost like a drum, and a dog that just cannot stop pacing, that is a textbook emergency. The later signs, like weakness or collapse, mean the dog is already going into shock. I really want this to sink in. This is not a wait and see what happens kind of situation. Without treatment, GDV is fatal. It often happens in just a matter of hours. So when a vet tells you this is a serious emergency, we absolutely mean it. Every single minute counts. So, you've recognized the signs, you're in the car, rushing to the vet. What's going to happen when you get there? I think knowing the process can really help lower the panic level in what is obviously a super stressful moment. The very first goal is to fight the shock. The vet team is going to spring into action, placing big IV catheters and pumping in fluids to support your dog's blood pressure. At the same time, they'll be trying to get the air out of the stomach, maybe by passing a tube down their throat or even using a large needle through the side of the belly. And then, an X-ray will give the final confirmation, showing that classic twisted stomach shape. All right, so once your dog is stabilized from that initial crisis, the focus is going to shift to the definitive treatment and the road to recovery. And the good news is, there is a very clear path forward. And this number right here, this is why we act so fast. With immediate veterinary care and surgery, the survival rate for GDV is over 80%. That's fantastic. It just goes to show you this is a highly treatable problem. But the key, the only key, is getting that treatment right away. So the path is pretty straightforward. Step 1, stabilize with fluids. Step 2, decompress that stomach. And step 3, the essential step, is surgery. The surgeon goes in, carefully untwists the stomach, checks to make sure the tissue is still healthy, and then they perform a procedure called a Gastropexy. That's basically where they tack the stomach to the inside of the body wall so it can't twist again. It's incredibly effective. Okay, so now let's switch gears and talk about how we can try to stop this from ever happening in the first place. Because for these at-risk breeds, being proactive is just everything. And these are really simple, practical things any owner can do. Instead of one giant meal, feed 2 or 3 smaller ones. If your dog inhales their food, get one of those slow feeder bowls. And definitely let their food settle for an hour or so before you go play a crazy game of fetch. And check out that last point. For years, we thought raised food bowls were a good idea, but newer studies actually show they might increase the risk. So it's best to just keep the bowl on the floor. Wow, just look at this chart. This is so powerful. If a dog has GDV and doesn't get that gastropexy surgery, the chance of it happening again is a staggering 80%. But with the gastropexy, that stomach tacking surgery we talked about, the recurrence rate plummets to less than 5%. It is a total game changer. And this brings us to a really important question for owners of high-risk breeds. You can actually choose to have that gastropexy done proactively, as a preventative measure. It's often done at the same time as a spay or neuter. It's a really important conversation to have with your veterinarian to decide if it's the right choice for your dog. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.